In this episode, I want to cover briefly a few things about COVID. I want to cover the church's position. We've seen some messaging come from them. I want to cover the politics a little bit on this. And I want to cover the environment, the debate that is happening really at an extreme level on both sides of the discussion. All right, so where do we stand now with COVID-19? Where are we at as members of the church? The First Presidency just came out with another message publicly to the members of the church, giving us guidance on the vaccines and on our behavior with COVID-19. The CDC today just recommended getting an additional third dose if you've taken Pfizer or Moderna. Those are the two vaccines that you have two doses for. A third additional dose for those that are immunocompromised, right? So even more vaccination on one side of things. Pregnant women, just a few days ago, the FDA approved the vaccinations for women that are pregnant. Well, what do you do with that? I see the two sides of this ramping up, unfortunately. And I'm going to show you why it's going to continue to ramp up for the next at least several months, maybe longer. But first, I want to set the stage a little bit, get some bearings on just exactly where we are at here. A lot of us stopped looking at the numbers globally and even in our own countries with coronavirus and the cases and the deaths. So I just want to hit that first, right? There have been so far globally 207,417,344 cases of coronavirus. This is as of August 14th, 2021. Deaths, 4,365,270. That is in a global population currently pushing 8 billion. Now, some additional numbers that we have as of today, and this is important. This is from the Associated Press. An Associated Press analysis of available government data from May shows that breakthrough infections in fully vaccinated people accounted for fewer than 1,200 of more than 107,000 COVID-19 hospitalizations. That's about 1.1%. Okay, so 1.1% currently of those that are hospitalized for COVID have been fully vaccinated. That's one thing to understand. Here's the second set of numbers. About 150 of the more than 18,000 COVID-19 deaths in May were in fully vaccinated people. That translates to about 0.8% or 5 deaths per day on average. Okay, so these numbers are very, very clear that your chances of being hospitalized once you're fully vaccinated is 1.1%. Your chances of dying from COVID are less than 1%. So those are facts that are important for you to make a decision. It may not change anything for you, but those are good numbers to know. Now, with that as kind of our base in looking at these numbers, I want to state right now that I am not going to try and tell you what to do in terms of getting a vaccination if you're sitting on the fence. This is more about how to go through that decision process and how to not be so divisive, right? We don't want to be so divisive in what we're doing here. It doesn't need to be that way. We are one people. We are one family of God. We are hopefully trying to be a Zion people of one heart and one mind. This pandemic shows us that we have got a very long way to go on this. So my attempt here is to try and have you see the other side a little bit, perhaps, and to make the right decision for yourself. So I'll be doing that with facts and with opinion on a situation that I think is going to be with us for some time. So we need to try and get it right. Now, one of the reasons I'm coming out with this episode right now, and I'm probably going to now do a lot more follow-up on COVID-19, is because, yes, I've been looking at this for a while. I've been studying this out. I've made my own decisions with this. But I really think that this is going to increase. It's going to snowball in its political force that is going to divide us more. So I want to try and help with that. And I've also had followers that have asked me specifically about this. Here's 3 examples from followers, their questions. One is, why is the church insisting so much that we get vaccinated and wear a mask? COVID-19 variants will be with us, just like the Spanish flu, until the end of this world. Here's another one on the other side. I can't understand why good members of the church won't follow the prophet. President Nelson is a prophet and a very accomplished medical professional. Help me understand. One more. I need some advice about the vaccine. It's odd to my soul to have it. Any words of wisdom? That's just a little bit of seasoning of what you find. These are all church members, right? Of what we're finding in the church. So let's get to this thing here. First of all, I want to look at this a little bit politically. I think that this is important. If we take a look here, this is from the Mayo Clinic. If we take a look at this map, it's very clear what is going on here. So the darker green you have here with each of these states, the higher level of vaccination that you have. You can see the very darkest states, without really exception. There's some that are kind of down the middle, but almost all of the very darkest states are left-leaning, right? They're blue states. Vaccinations have turned very political. That's my concern. This should have nothing to do with that. This should be completely up to individuals. Why would it be this way? Why is this split? Why is the manifestation of this, the implementation of the vaccines, showing up here as a red versus blue state scenario? If you've got a good idea of that, by all means, leave a comment for me. Let me know. The other thing I want to go look at here, and this is really important, and we're going to get into this a little bit because this really speaks to the battle we're going to have here between liberty, personal individual liberty, which especially here in the United States, right, is very important to us and in the West, and then secondarily here to the societal needs, right, of the collective. This is a battle that is going to go. And what is it that determines which side we're going to lean toward on this? This will be important. If you look down here, you're going to see here this blue line is those that are fully vaccinated throughout the United States. Okay, and this is going to apply to almost every country the same way. We are sitting here now at 50.7% as of August 14th. Of fully vaccinated individuals in the United States. To me, that's remarkably high so far. Seeing that we've started, back in December or so of 2020. And we're even higher here as far as those that have received almost one dose. There's a 10%, a 9% difference here. So we really have about a 3-week window here to grow another 10%. Almost all of those people will get a second dose. So within 3 weeks, we'll be at least 60% of fully vaccinated throughout the United States. Why does that matter? Well, it matters on several levels. Number one, it matters because how fast is the virus going to be transmitted, right? It's an extremely contagious virus. How fast is that going to be transmitted? That depends on how many people are vaccinated. That's the societal concern on one side. Now, who are the 50-60% that have gotten vaccinated? Well, in some cases, it's the early adopters early on who are very comfortable in doing this. They're very concerned about the virus. And then little by little, more and more people get it. Maybe it was an issue of scheduling. You're busy. But for the most part, I think it's a level of what concern do I have about getting this? And do I want to be able to walk around, especially early in 2021, without a mask on if I choose, in most cases, even though you may have been asked to put a mask on? But here's the important thing to look at for the next several months and maybe longer. And that is this green bar up here at the top. right? This green bar at the top here is showing you 80 to 100%. This is the goal of governments and healthcare professionals and agencies, right? They want to get to 80% vaccination rate. And hopefully it won't change from there. Who knows? But they want to get to 80% vaccination rate. Why? Well, because they feel that at 80%, it's going to dramatically slow down the spread of the virus. There will still be COVID. We're going to always live with COVID, perhaps, but it's going to dramatically slow everything down. So here's where we're at. We are going to be at 60% within a few weeks. We're going to have to fill this gap here between 60 and 80. When I say have to fill it, the governments and healthcare agencies are going to want to put measures in to move from 60 to 80%. Right? They've got to move from here to here. That is what they are trying to do. Here's the problem. What percentage of individuals don't want to get the vaccination at all? What percentage of individuals are worried about it? Maybe they would if they had some more information. They haven't gotten around to it. What percentage of individuals are in that boat? And how long do the healthcare industry and especially governments, right? Government is the enforcer. How long are they going to wait until we get to that 80% mark? That's what you need to keep in mind. This is what is going to drive the problem politically over the next several months, is that gap between 60 and 80%. Because those that are more willing to get the vaccine have already gotten it for the most part. Those that have dragged their feet a little bit on it, they're not sure about it, they've had some fear about it, possibly very reasonable issues, right? Very reasonable issues that they don't feel that they should get it, at least not yet. I took a while to do it. Everybody's different. So as we move up in that percentage rate, we're going to be looking at the balance of individuals who are going to be more reticent to get the vaccine. And that's where we're going to have the problem. And I'm not looking at one side or the other as the problem on this. That's not the problem. The problem is just what it is. A goal for world governments and for world health agencies versus individuals' choices. That's the problem. And I'll show you where I think the church is going to fit into this. So here's where we start to look at this what we're going to do in closing this gap from 60 to 80%. This is an example from Australia, who is now, especially in the Sydney area, but in many other places, in going into complete lockdown and enforcement. They want to get to the 80%. That's what this is all about when you see this. So here you have an authoritative police figure here. I'm not sure who this is. Maybe the police chief of Sydney. I don't know. But he's saying it's unbelievable that people are still doing this, in regards to where they're at right now. What's interesting is their numbers aren't even as bad as the United States. But they're going into severe lockdown and travel restrictions. So this, again, that's 60 to 80%. What's going to be going on between that 60 and 80%? What government policies are going to be put into place? And is there any residue of those policies even after we get to 80%? That's always a concern, right? With any body, any individual, any government, oftentimes it's you give an inch, they take a foot, right? Or more. So that's an issue, and I think that's what some people are very concerned about.
Good morning, Premier, Minister. Good morning, ladies and gentlemen. In the last 24 hours, 404 infringement notices have been issued and 41 people charged with breaches of the public health order.
Okay, so he goes on and he's going to talk about a few young teenagers and young women that were also charged. So why are they doing this? It's not that there's that many people. They're trying to tell you you're going to get in trouble if you travel, if you break the travel restrictions. So that's an increase in government authority. And this is something I want people to understand, that, where people perhaps on the right would be coming from. That's their concern. Usually, not always, but usually on the right, you have a bigger concern about government and authoritative government. The state teams, the left seems to, be a little easier with giving government more power. The question is what is the right solution? How much authority do you give to the government to do this? And then something that's actually very disturbing to me is something I've seen in the United States with very high-level health officials as well, in talking about the amount of freedoms you give to people and using the freedoms as a carrot. In other words, take away the freedoms, but if we get up to a certain level of vaccination, then we'll give you more freedoms. And it's not just a matter of practicality of the disease spreading. That's what people are going to come back and say to me. That's not what they say. They actually are using it as a carrot. We'll give you your freedoms back if you get vaccinated. That's a problem. Let's listen to what they say here.
But I want to make very clear that what we want to achieve in September and October is provide some opportunities for people to have an extra thing that they can do, which they currently can't do today. But I don't want to give the impression that it's going to be freedom all round. It's not going to be freedom all round till it's 70% double doses at least, and then 80% is when we learn to live with COVID.
Okay, so there we get the 70 and the 80%, right? They'll give you some of your freedoms back after 70%. And then we'll live with COVID after 80%, and then everything can change at that point. That's what I'm saying here. See, that's what they're looking for. That is what the world, the global leaders are looking for. They want 80% vaccination rate. Right now, having heard that, understand that even in the United States and many other countries at very high levels, there is a lot of discussion about limiting freedoms. And it's not just a matter of travel. It's not just a matter of lockdown. It's a matter of creating a carrot. It's saying, let's remove these freedoms. And to some degree, let's force the vaccination even. Or let's make it so unbearable so that we close that gap from 60 to 80% fast, right, with vaccinations. That's happening. Those talks are happening. So having heard here from Australia, let's go to all places, the United Nations, who here, this is from a year ago. This is from a year ago, June of 2020, talking about how we should not be removing individual rights in a pandemic.
Some governments are taking advantage of the coronavirus crisis in order to stifle dissent. That's according to the UN High Commissioner for Human Rights, Michelle Bachelet. She's been speaking to France 24's Mark Perelman about her concerns.
Okay, so there's concerns. The UN is saying that there's concerns.
When we restrict certain human rights because of a need like a natural cause or a pandemic like this one, it has to be, first of all, it has to be a clear need. It has to be proportionate to the need, and it has to have a time bound.
All right, so you can see why some people, especially on the right, but a number of people might be very concerned about giving the government more power. And how much power are they going to take if they want to a certain goal with this pandemic of getting to that 80%? What are they going to do? Now, certainly there are conspiracy theories and there's way too much that's put out there on this, but there is a legitimate reason here to look at things. That's the first thing. The second thing, though, is to realize that your choice to get vaccinated should have nothing to do with the fear or the balance there of personal liberty versus the collective, versus the society, versus the government. That should have nothing to do with it, unless you're trying to make a statement, which seems like a very secondary type of a decision. It should have nothing to do with this battle between individual freedom and the collective, right? You should be able to disengage political issues here from your decision whether or not you should get a vaccine. Now, we've seen this globally. We can go to France. We saw the protests there in France. What was that over? It was over government control. That's what's happening, and that's what the argument is here.
Tonight in France, the fight over who needs to get vaccinated hitting the streets. Demonstrators in Paris pelting police who respond with tear gas and fists.
Okay, so again, this is an issue of how far is the government going to encroach on my freedoms?
They claim the choice to get vaccinated should be about liberté, freedom.
That's
I
one
think our
point.
freedom is in danger. I have children, she says. I'm fighting for their future. They're outraged over a new
Passionate.
virus pass coming into effect August 9th that would legally restrict entry in most places like restaurants, bars, and theaters to the vaccinated and those with a recent negative test. I won't sell my soul to go to the restaurant, the cinema, says this man. There's nothing above freedom.
That is going to be a real battle, and it's going to increase. My point about this, when I say things are going to escalate, is that the push for those reticent individuals in getting from 60 to 80% is going to come harder, I think, from the government. I think that they're going to push harder and harder as that line slows down, which it probably will for a while, of moving up toward 80%. This is going to be a big effect on individuals there in France, right? You're going to have a pass. And by the way, this pass passed just a few days ago. It is now, despite the protests, a thing in France. For you to be able to go to restaurants or to the theater or travel or do many other things, you have to show that you've been vaccinated. So they are creating two different levels of citizenship. Now, for them, they're going to do it just short term until they get to probably that 80%. That's what they're saying. That's what the battle is. Okay, so this is a real issue, right? That we need to look at, a lot of people are saying, well, for the collective, we need to do this. And to the up to the extreme of government force to get people vaccinated. And then on the other side, they're saying, well, wait a minute here. I don't want to get vaccinated. And how far is the government going to be allowed to encroach on my individual rights? Those are two, both sides have very good arguments on that. That's why it is such a lightning rod, because there are two good reasons on both sides of this. The question is, what should win out? For me, I think you've always got to give the individual their choice, especially at this point in the pandemic. I don't want to infringe on your freedoms because it would be a little nicer for me if more people got vaccinated. That doesn't seem right to me. I have the ability to get a vaccination, which I have, right? I did this back in May. I have the ability to go get a vaccination. I've had now about 9 months to be able to do that. I am very immunocompromised, so I've been able to get this right from the get-go. So why do I have to have you do it? I don't have to have you do it. You have your own choice. You're an adult. You can reason. You can go through these things. You should be able to make your own choice. This balance of state control over that freedom of choice is really, it's a very delicate balance. Now, what I do believe is that the longer we go with these vaccines, right, we get to, say, for example, a year, we get to December here of 2021, things are going to change more and more as far as where the responsibility lies. For example, right now, the Supreme Court earlier this year said that it is the right of companies to be able to mandate that their employees get vaccinated, and they can fire them if they don't. Now, regardless of what you think of that, what's going to happen eventually is that the percentage is going to get higher. We're going to move to 65%. Eventually, we'll get to 70%, regardless of how we do it. Hopefully, we do that in the proper manner through choice. But the onus, the responsibility is going to fall more and more on those who have chosen not to get vaccinated. And they have that choice. They should have that choice. So eventually, if somebody is hospitalized or, God forbid, somebody dies after a year of choosing not to get vaccinated, that is their responsibility. You can't flip all of society on its head and say that everybody has to be masked and everybody has to be vaccinated, or a larger percentage has to be vaccinated, when people have had that long to choose. That is their choice. More power to you. You choose what risks you want to take. If you think the vaccination is a bigger risk than getting the disease, that's your choice. I don't agree with it. But again, I don't want to impose or infringe on your choice. That to me is somebody else's plan. Now, before I get back to the church on this, what is likely to happen? I think we need to think about this. What is likely going to happen? This may play a role in your decision or it may not. I don't know. But what is likely to happen, pretty high possibility, is that more and more people over time are going to get the vaccination. They're not going to want to worry about it. Over time, it's going to become less and less political. Over time, people are going to be more and more comfortable with it, regardless of the fact that a very, very few percentage of individuals are going to have reactions to it. And this is how all of these things always work, right? There's always early adopters to it. They take the high risk, honestly. But to them, it's a good risk. And then there's other people that are going to follow little by little. I remember when bottled water first came out. I was not an early adopter. I thought this is absolutely preposterous. Why am I going to go pay money for some company to go bottle my water for me and then buy it at the store? I wouldn't do it for the longest period of time. I was one of the stragglers. I was one of the last people in America to buy bottled water. I'm telling you. And now I always have it. I've always got it in the refrigerator. So there is always a process to these things. But you know what? I had my choice. Good or bad, I made my own choices and had my own reasons for why I was going to buy bottled water. And that's how it has to be. To me, right? We've got to be able to make our own decisions on this. All right, now back to the church. We can go back and look at the prophet, President Nelson, getting vaccinated and showing this to everybody. This is back in January 19th, 2021. Very early. He got it as soon as he could. All of the First Presidency did. And this was really a big issue for a lot of people. They did not like this. I remember back in when the church came out with immigration against what a lot of people on the right were saying about immigration. This was back in maybe 2010 or so. It was not what a lot of people liked, right? We're going to hear things all the time that we don't like. The question is what do you do with that? How do I close the gap between what I hear from church leadership, especially the highest level of church leadership, and what I believe myself? Can I close the gap? Let's look at what is said here in the church newsroom in January 2021. In word and deed, the Church of Jesus Christ of Latter-day Saints has supported vaccinations for generations. As a prominent component of our humanitarian efforts, the church has funded, distributed, and administered life-saving vaccines throughout the world. So this is not just the COVID thing. They have always had this type of a policy with vaccination. They have felt good about helping eradicate disease around the world. So this falls into that in that context. The First Presidency also urged church members, as appropriate opportunities become available, to be good global citizens and help quell the pandemic by safeguarding themselves and others through immunization. So that's pretty blatant as to what they're saying. So for some people, that's like getting hit with a lightning bolt. For others, it's obvious. What I would say on that, as far as looking at the process of lining this up with yourself, is first of all, what inspiration would the prophet have in putting this out there to the church members in a time frame that was very, very early on in being able to get the vaccine? I have personally a certain there's something additional in my life, right? That goes along with this. That President Nelson saved my life. Literally. He literally saved my life. How did he do that? Well, he is one of the, I believe there are two individuals that together came up with the bypass machine that is used for, and the technology that is used for people that get bypass surgery. I had that. I would not have been able to have that bypass surgery without that machine that basically takes the blood and pulls it and helps it flow back into the heart. So for me, in my mind, what I consider is, okay, this is a man that is led by God. He is inspired to do this. I mean, he's not always going to come out and say something like this, right? You don't hear them come out with issues like this very often, maybe once every couple of years, few years. So this is not a flippant statement. Secondarily, he's a very, very accomplished medical professional, and he felt very comfortable with the vaccine early on. Now, maybe that's not enough for you. Maybe neither of those reasons are enough for you. I don't know. It is for me. Both of those play right into my decision making. Now, just recently, a couple days ago, they came out with another public message to the church members. Here it is. The First Presidency urges Latter-day Saints to wear face masks when needed and get vaccinated against COVID-19. For me, I'm going to take this out of a political situation. That's the last thing in the world that I want to do. Again, I'm not telling you that you are supposed to get vaccinated. I'm telling you that you need to make your own decision and that you have the freedom to do so. I'm just trying to give you some facts and maybe a process of being able to make that decision and give you an idea of why I made the decision that I did. If you are looking at Facebook and watching TV political editorial all the time, and on Twitter all the time, and you've constantly got the same message, one side or the other, I hope that you can separate yourself from that environment and not make this a political decision. J. Max Wilson, who is an LDS blogger that I know, had a thread on this on Twitter, and he said a couple things that I just want to share with you before closing on this. He said, I agree that individuals need to be able to follow their own inspiration and the advice of their own doctor and make their own decisions. That is bedrock key, right, to the political situation. I think that it is conceivable that the Holy Ghost could authorize some members to not follow the strong recommendation of the First Presidency regarding vaccination. I am also pro-vaccination. I think it's the right thing to do for almost everybody. The only political part of this is how that moving between that 60 and 80% is going to happen. That should have nothing to do with your choice, I don't believe. But it is your choice. You can decide to listen to what President Nelson said. You can decide that you've prayed and you've gotten your own answer. And that's possible. This is not a commandment from him. It's strong advice. I appreciate your time.